Telemedicine has been a pretty hot topic over the past year and a half, 2 years. The COVID-19 pandemic has made telehealth almost indispensable for a lot of medical practices, those who wanted to remain open and still seeing patients, but didn't want to necessarily risk patient-to-doctor contact. A quick survey of providers on my email list shows that many of them are involved in telemedicine, and it looks like it's here to stay. I'm Steve Goldring from simplehormones.com. I help patients and healthcare practitioners with easy-to-understand patient education resources. Well, if you're like most people, you may be a little zoomed out. Over the past year and a half, I've had more Zoom meetings than I can really count. After a while, it's easy to get burned out on those virtual conference calls and business meetings. But the necessity of all of us meeting over Zoom has actually been a good thing for some industries, including medicine. There are some significant cost savings and some convenience factors when you just have to make sure you're wearing at least a shirt before you commute the 25 feet to your home office and take your coffee cup and your place in front of your webcam. Telemedicine has, of course, completely taken off in the past year and a half or so. Several states who had been maybe sort of dragging their feet on allowing physicians to see patients virtually, they sort of accelerated their telehealth laws, and now it's a lot more prominent in a lot of states. One aspect of telemedicine that's likely to translate into the post-pandemic medical practice is health coaching, especially health coaching by video conference or some other virtual meeting technology. Video-based remote health coaching is a perfect companion to telemedicine. So let's say a patient in the Central Valley of California wants to see a hormone optimization provider, but there's not really a qualified provider within about a 3 or 4 hour drive. But there is a California licensed hormone specialist who can see that person via telemedicine. I happen to know just such a provider, and she's now located in Texas, but she still sees California patients. So that Central Valley patient might let's say get her labs drawn locally and have a 30 to 45 minute, maybe even an hour visit with her provider over telemedicine. The provider might notice that the patient is showing some signs of insulin resistance, let's say high hemoglobin A1C, high fasting blood glucose, high fasting insulin levels, and a calculated HOMA-IR score that's based on their fasting blood glucose and their insulin. That's their insulin resistance score. The provider might recognize the value of intensive coaching around diet and exercise and sleep hygiene and maybe even nutritional supplements. While the physician could do that health coaching herself, it's probably the kind of thing that she'd be maybe charging a lot for. It's also something that might require weekly check-ins and regular meetings to help the patient both keep informed and stay motivated to make those lifestyle changes and make them stick. So the physician might not have the time or the inclination to offer those health coaching services themselves. Rather than doing the coaching herself, the provider could refer that patient to a health coach who specializes in helping people with insulin resistance or type 2 diabetes. So of course, insulin resistance is pretty closely tied to diet and lifestyle factors. Those factors are kind of great candidates for a health coach to talk the patient through what they've been eating, kind of find out when they eat, how much they eat, what kind of their dietary patterns are, maybe offer some helpful, encouraging alternatives when it comes to food, help to reinforce healthy eating choices on a weekly basis, maybe providing simple, easy-to-follow guidelines for grocery shopping, for menus, for recipes. All that positive, encouraging input from a health coach could have a big impact on insulin resistance and on the patient's compliance, her willingness to make the changes she needs, and to really stick with those changes for the long haul. Well, one of the beautiful things about health coaching is that the coach and the patient, or sometimes called the client, don't have to be in the same room or even in the same city. Coaching via video conference has been around for a while, but the pandemic has really caused an explosion of online or virtual coaching for all kinds of situations, like business coaching to maybe music lessons to health coaching. The benefits of virtual remote health coaching, specifically for patients with insulin resistance, have been documented in a couple of clinical trials over the past couple of years. It's not just a good idea, there's actually data that shows virtual health coaches can make a real difference in the lives and health of insulin-resistant patients specifically. Health coaching might be able to help other patients as well, maybe psychiatric patients or patients with other types of issues. But insulin resistance seems to be sort of tailor-made so that health coaching can have an especially positive impact on insulin-resistant patients. One of the clinical trials I'd like to highlight is entitled Telemedicine-Based Health Coaching is Effective for Inducing Weight Loss and Improving Metabolic Markers. This trial was published in Telemed Journal and eHealth back in 2019, before the pandemic. 30 adults were randomly assigned to one of 3 different groups. The first was a group that received health coaching via video conference. The second was a group that got in-person coaching, and a third control group got no coaching. The patients in the coaching groups were given wireless watches and scales to sync with their smartphones, and the devices sent encrypted data to a secure database so the researchers could look at it. Patients were followed for 3 months or 12 weeks. The primary endpoints of the study were all about weight loss over the 12-week study period and steps per day, as well as fasting blood glucose, hemoglobin A1C, and a calculated HOMA-IR, or insulin resistance score. After 12 weeks, the patients who got coaching via video conference had actually lost significantly more weight and had significantly lower insulin resistance scores than either the control group or the group who got in-person health coaching. There were no significant differences in blood glucose or hemoglobin A1C between the 3 groups. Another trial, telehealth-based health coaching, increases mHealth device adherence and rate of weight loss in obese participants. It was in the Journal of Medical Internet Research. It looked at weight loss in 25 obese patients assigned randomly to receive either weekly video-based health coaching or self-guided treatment recommendations. The primary outcome for this study was about adherence to a remote monitoring device and a healthy rate of weight loss. The results of this study show that the video health coach group lost more weight and adhered to the monitoring devices better with virtual health coaching than patients without coaching. Patients receiving video health coaching lost about 1.6 pounds apiece, while the control group actually gained about 0.4 of a pound. A randomized clinical trial evaluated health coaching for 138 diabetes patients in Toronto. The 138 patients were randomized into 2 groups. One group received a Samsung smartphone that had a user account with a wellness app included. The app tracked their blood glucose levels, their exercise, their food intake, as well as their mood. Patients had access to their health coach 24 hours a day through the app's messaging system. They also had opportunities to meet with a health coach either in person or via a scheduled phone call occasionally. Control group patients received support toward meeting their goals, but they didn't have a smartphone or health coaching or the health coaching app. The primary outcome for this study was about hemoglobin A1C from the starting point, baseline, to 6 months. There wasn't a hugely dramatic difference between A1C levels for the 2 groups after 6 months. The study authors sort of tried to do some sleight of hand to give the conclusions a bit more pizzazz, but it didn't make the study all that much more exciting. Overall, this study did show improvement in both groups, and there is an argument that the health coached group may have done a little better over the long term, longer than the study actually covered. Another trial, diabetes prevention and weight loss with a fully automated behavioral intervention by email, web, and mobile phone, a randomized controlled trial among persons with prediabetes. Say that twice really fast. This trial offered patients with pre-diabetic fasting blood glucose levels, those are around 110. It gave those patients access to an online health coaching program called Alive PD that included tailored behavioral support for improvements in physical activity, eating habits, weight loss, stress, sleep, weekly emails with maybe suggested goals that were tailored to specific data points or specific things that the data showed the researchers. Patients were given specific web pages with tools for tracking and coaching and social support. They had a mobile phone app again. They had automated phone calls. Notably, the treatment group did not get virtual health coaching on an individual patient basis. It was rather more of an automated intervention that didn't involve actually meeting with a coach, either in person or on a video conference platform. The results of this trial were that patients who got the Alive PD interventions had significantly increased reductions in fasting blood glucose. The average glucose decrease in the treatment group was 7.36 milligrams per deciliter, while the control group only decreased by 2.19 milligrams per deciliter. There were also significant reductions in hemoglobin A1C and body weight in the treatment group as opposed to controls. The authors said Alive PD improved glycemic control, body weight, BMI or basal metabolic index, waist circumference, triglyceride to HDL ratio, and diabetes risk. Health coaching really can make a difference, specifically for insulin resistance and type 2 diabetes patients. Virtual remote health coaching doesn't require patients to be in the same location as their coach, which can have some pretty big benefits in terms of transportation for patients who might not be able to afford it or get a taxi, especially when they're located far from a healthcare center. Remote health coaching might offer significant cost savings that could be passed on to patients who are likely to be paying for health coaching out of their pocket. A lot of health insurance really doesn't cover health coaching very much. If you're a patient who maybe isn't so close to a major city and you'd like to find a hormone optimization provider, maybe remotely, click the link that says Find a Provider. I can't guarantee I know somebody who can help you, but I'll give it my best shot. If you're a hormone optimization provider and you might be able to do telehealth with patients that can't get to you, join my provider database and I'll look for patients in the state where you're licensed. And maybe the two of you can get together virtually anyway. If you found this video helpful, click the like and subscribe buttons to get notified anytime I post a new one. Thanks so much for watching, and I'll look forward to talking to you again soon.